Hi friends, I am Dr. Pratash Rathod. I have done the MD in Forensic Medicine. In today's video, we'll continue with inebriant poisons, that is intoxicating poisons. In last video, we completed alcohol poisoning. In that, we discuss about acute alcohol poisoning, that is ethanol, mainly the ethanol poisoning we completed. And continuing from that, we'll discuss about now is the methyl alcohol or methanol. Methyl alcohol or methanol is created through breakdown of naturally occurring pectin, which is a complex carbohydrates during the fermentation process. It is usually a natural byproduct of fermentation of ethanol. From ethanol, we know that any carbohydrate, when acted upon by yeast, it forms the alcohol. So, in alcohol, during this process, that is, it will usually form ethanol, that is, we commonly refer as alcohol. So, ethanol is formed, but sometimes some carbohydrates like pectins, when acted upon by yeast by pectins, this pectin results in formation of methanol. So, usually when ethanol is formed, methanol is also formed, they are present, but with this very less in quantity. When this quantity will increases, it leads to poisoning. That it is sometimes seen in homemade alcohols, in that the methanol formation may sometimes increase, leading to poisoning. Pure methyl alcohol, which is also known as wood alcohol or methanol, is a colorless volatile liquid with the odor similar to ethyl alcohol and has a burning taste. So, it has similar properties of ethanol. It is also and and has a burning taste. Mineralized methylated spirit consists about 90% of volume of ethyl alcohol and 95% of wood naphtha. So, the spirits which are present usually consist of 90% of ethanol and 9.5 of wood naphtha or the methyl alcohol. So, food naphtha is nothing but the name of the methanol and 5% of crude pyridines. It is present in certain homemade beverages also, in antifreezes, paint removers, dyes, resins, adhesives and varnish. It is usually present as a additives. Coming to absorption of methanol, it is rapidly absorbed through the stomach and intestines and also through the lungs and skin. Though small doses tends to accumulate in the body. 80 milligram per 100 ml of blood is dangerous. So, if only just 80 milligram percent if it is present in the blood, it is dangerous and is fatal. It does not completely disappear from the body for 3 to 4 days. So, the methanol has a property of accumulating in the body. So, it starts accumulating and it is difficult to remove. Methanol is oxidized by the liver to formaldehyde, which is 33% more toxic than methanol. So, usually we know that ethanol, when acted on in the liver, it forms acetaldehyde, and this acetaldehyde, when acted again by acetaldehyde dehydrogenase, leads to acetic acid and carbon dioxide is present. So, this is normal present, but in methanol acted upon by the enzymes, it forms formaldehyde, and later on it leads to formic acid. So, these two, formaldehyde and formic acid, are the most toxic inducing properties, which in turn is formic acid, which is 6 times more toxic than the methanol. Formic acid is responsible for the associated metabolic acidosis as well as renal toxicity. So, formic acid has leads to acidosis and toxicity. Formic acid as format may inhibit the cytochrome oxidase, increasing lactate production and leading to metabolic acidosis. It is distributed in the tissues according to their water content, and because of that, there is high concentration is found in vitreous and optic nerves. So, formic acid is easily absorbed in water. So, any tissue which has high water content, it gets accumulated. So, the effect of formic acid is mainly seen in the eyes, in the vitreous, in the eyes and optic nerves. Elimination: the liver slowly metabolizes the methanol slowly. It is gets accumulated and slowly removed. 3 to 5% is excreted through lungs and about 12% is through kidneys. Coming to signs and symptoms, methanol produces symptoms of drunkenness in the same way as ethanol alcohol, but inebriation is not prominent and the effects are more prolonged. So, symptoms are similar to that of alcohol drunkenness state, but the state is less prominent. Symptoms may appear within an hour or may not appear for 24 hours. They consist of nausea, vomiting, pain or severe cramps in the abdomen, headache, dizziness, neck stiffness, confusion and vertigo. There is marked muscular weakness and decreased cardiac action and hypothermia. There may be dyspnea and cyanosis may also present. The odor is usually present in the breath, that is of alcoholic. It will be similar of ethanol, but it is so will become confusing. The effect on the central nervous system is more intense and persistent than with ethanol alcohol. So it is, since it gets accumulated, so there is in CNS it has more intense symptoms present. There may be delirium. The person may go to coma, which may last for 2 to 3 days. There is a toxic effects on the liver and kidneys as well as, which leads to acute tubular necrosis of kidneys, and highly specialized nerve elements it affects. Urine strongly becomes acid and may contain acetone and a trace of albumin. Acidosis is caused by the inhibitory effect on the oxidative enzymes produced by methanol, with resultant accumulation of lactic and other unintended acids. So, because of formic acid, it causes inhibitory action on the oxidative enzymes on the cells, leading to accumulation of other acids like lactic acid, which is formed, and also some identifiers also accumulated. In the eyes, so methanol produces typical features in the eye symptoms. The pupils will be dilate and fixed. Then later on there is visual disturbance is present. So these symptoms are typical of methanol poisoning, and this is diagnostic, and it can be differentiated between ethanol and methanol. Ethanol doesn't have eye symptoms, so these type of symptoms will not be present in ethanol, but it will be seen in methanol poisoning. Visual disturbance includes photophobia, blurred or misty vision, that is no field type of vision present. Person will see spots. Central and peripheral scotomata, the person's visual field of vision is decreased. Decreased light perception, concentric diminution of visual fields for cell color and form, followed by fairly sudden failure of vision or complete blindness occurs due to optic neuritis and atrophy of the effects of formic acid and optic nerve. So because of formic acid on the optic nerve, the person's field of vision, there will be spots will be present. The person will see the spots. Then there may be decreased. There may be field of vision will decrease. Later on, the person they will not be able to differentiate in color and form of any whatever is seeing, and there is sudden failure of vision. The person may lose even eyesight because of optic neuritis and effect of formic acid on optic nerve. 10 to 20 ml of methanol can cause blindness in the person. Fundoscopy may show hyperemia of optic disc followed by retinal edema. Retinal ganglion cells and optic discs may show degenerative changes. In fatal cases, conversions are usually occur as a terminal event and person may which leading to death. Coming to diagnosis, severe non-diabetic non-metabolic acidosis in unconscious person is suggestive of methyl alcohol poisoning. So, if the person is non-diabetic, if there is a metabolic acidosis occurs in them, which should be which should make us make suspicion of methanol poisoning. An increased osmolar gap accompanied by visual symptoms suggestive of methanol poisoning. So, if there is a visual symptoms are present and there is gap osmolar gap is present, then it should be methanol poisoning should be suspected. An anion metabolic acidosis characteristic of methanol, ethylene glycol diabetic acidosis, lactic acidosis, and saturate intoxication. So, any metabolic acidosis we suspect should be methanol poisoning, ketoacidosis, lactic acidosis, and saturate intoxication are some differential diagnosis. 60 to 200 ml of methanol is fatal. 24 to 36 is the fatal period, which may delay for 2 to 4 days. Cause of death is mainly due to acidosis from production of organic acids. Senior depression is a minor factor, and the usual person die because of acidosis. Treatment: gas lavage using 5% bicarbonate solution, which should be done, and 500 ml of should be left in the stomach to counteract for formic acid. Activated charcoal reduces the motility significantly. It acts by reducing the absorption of alcohol from digestive tract and by creating a concentration gradient in favor of movement of alcohol in the metabolites back in the gut. So, once the stomach wash is done, if once the active charcoal is present, it removes the alcohol from methanol from the stomach. Because of that, if any methanol is present in the intestine, it will be in the blood stream, it will be reabsorbed into stomach and which can be removed from stomach wash. The main antidote is the ethanol. So, for methanol poisoning, ethanol is given. So, methyl alcohol is oxidized to formaldehyde as we mentioned. So, this catalyzed enzyme can also oxidize ethyl alcohol to acetaldehyde. So, methyl alcohol poisoning, ethyl alcohol by competition for catalysis blocks the formation of formaldehyde and allows the less toxic methyl alcohol to be excreted and metabolized. So, as we mentioned, ethanol is metabolized to acetaldehyde and methanol to formaldehyde. So when ethanol is given in large doses, when it is favored by the enzymes. So enzyme favors the ethanol, so they leave the methanol by competition for enzymes. So methanol is not metabolized to formaldehyde, excreted unmetabolized. It is given IV has 10% solution and repeated as required until the blood levels fall by 25 mg/cent. So till the methanol is removed, the treatment is continued. It can be also given with IV, or it can also be given by oral route, can also be tried. Hemodialysis treatment of choice in severe cases of poisoning. So in severe poisoning, ethanol, if it will not be effective, and to remove the methanol from the blood, hemodialysis is given. 4-methylpyrazole, it is also similar action like of ethanol. It is also competitive inhibitor of alcohol dehydrogenase enzyme and can be used instead of ethanol. Folinic or folic acid 50 to 75 mg every 4 hours is also useful to increase the elimination of formic acid which is present in the blood. Blood sugar should be measured frequently. So these are symptoms are done when the ethanol is given. So since we know ethanol prevents the absorption of vitamins as well as it absorbs the glucose, it prevents the glucose absorption. So blood sugar should be measured frequently. Alcoholic ketosis also in crystallized therapy, dextrose, thiamine and phosphate should be given. So alcoholic ketosis should also be kept in mind. It may happen, which has to be contracted. Sodium bicarbonate IV to correct metabolic acidosis. Patient should be kept in left decomposition to in recovery position to avoid aspiration of vomit. Eyes should be kept covered to protect them from the light, and the airway should be kept clear for recovery positions. So these are the basic things which also be done to prevent the aspiration as well as recurring the patient. Postmortem appearance. Cyanosis is marked and there is the absence of postmortem clotting of the blood. The period may be given give the skin a purple color. The mucous membrane of the stomach and the duodenum is congested and inflamed, and small hemorrhages may be seen. Small or large intestine both are contracted, resembling a thick pipe of narrow. So it causes contraction of stomach and intestines are seen. Other symptoms of cyanosis is absent. The lungs are congested and edematous. Brain is edematous and shows local hemorrhages. The mucosa of the bladder is often congested. The liver shows fatty changes and sometimes early necrosis, and there is tuberogenesis of kidneys. So though there is no specific changes, the usual changes of asphyxia changes, congestion of organs is present. Coming to analysis, methyl alcohol and formic acids are found in all organs, blood and urine. To diagnose the methanol poisoning, usually blood or any tissue is taken to measure whether there is presence of formic acid. It is present in organs, blood and urine. Formaldehyde cannot be demonstrated. Only anticoagulants such as EDTA, heparin, methylamine and formalin give the positive test for methanol. Circumstances of poisoning. Poisoning is mostly accidental. As I mentioned, methanol can be formed as a byproduct of poisoning, byproduct of fermentation. So it is accidental poison. Sometimes it is used as an intoxicating beverage when ethanol is not available. So sometimes in homemade beverages the methanol is formed, or methanol is also added in ethanol to make the beverage cheaper, and which leads to poisoning. These are my references. Thank you.